Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Wednesday, July 31st, 2024, and you are here in the Java Cafe. We are here this morning. We are expecting Dr. Kevin Simone. We're going to talk about Black men and mental health, but until he arrives, let's just check in on some things politically. So yesterday, Kamala Harris had a rally, a couple of them. Quavo performed, Megan Thee Stallion performed. There's chatter on social media about twerking and Megan. And listen, as we talked about with Neil yesterday about the little woman, Sexy Red, and how the Republicans have embraced her and using her. There wasn't that much. Well, there's some backlash about that, but Megan Thee Stallion is very much educated, a HBCU graduate, is an artist, and that audience that she engages to be politically engaged and engaged with the electoral politics process is a good thing. So anyway, but at the rally, Kamala was kind of feeling herself a little bit and had the nerve to say, Donald Trump, as we know, is using the resignation or the stepping down of Biden, and Kamala stepping up as a way to get out of the planned debate that was scheduled for September 10th. He doesn't want to debate. So Kamala was like, basically, y'all out here talking trash. And she literally said, I'm reminded of the old saying, if you got something to say it to my face. Now, I might get in trouble for this, but all Kamala needed to do was have her homegirl put her hair in 2 braids, put some Vaseline on her face, and be like, what's good? Kamala, listen, that is the energy that we needed in this campaign. And so I am glad that this Black woman stepped up. I always say, if you need something fixed and America needs to be fixed, call a Black woman. Put it in front of a Black woman and it'll be handled. Anyway, yesterday we had the opportunity to speak with Neil. Dr. Simone just joined us, and we're going to bring him in a second. But if you missed yesterday's episode of Java with Jimmy, go back and watch that. We delved into the impact of music and hip hop culture and the elements, how they are a violence prevention model, youth engagement model, contributes to the economy through employment. And so we are definitely encouraging you to go back and watch that episode. And so I'm getting ready to bring my good brother in. He is the first city's chief of behavioral health, is very active all over the place in a few spaces. He's an academic. He is a lecturer. He is a professor. But most of all, he's a Black man that cares about community. He's a dad. He's a husband. And so without further ado, and this isn't his first time on here, I would like to bring in, present to some, and introduce to others, Dr. Kevin. And I've been trying to say it right, sir. Simone.
Well, thank you, Jimmy. Yes, it really does depend on where you are. So in my household, you might hear Simone. And when I say household, where I grew up in Brooklyn, New York. My parents are Haitian.
Shout out to Brooklyn. Ça
Um,
passe?
Sac Passe. So Simon is the correct Haitian Creole pronunciation. The American version is Simon, like Simon says.
It just, it's
Alvin,
so
Simon, Theodore.
disrespectful.
I appreciate you even attempting to say it right. But it's a pleasure to be here. Yes, not the first time. Hopefully, not the last time.
Oh, not at all. Not at all.
I thank you for referencing being a dad. In part, I was on Huntington Avenue trying to get my daughter to YMCA camp and looking at the time and like, baby, do you want to come with me to the office? Because I don't know if we're gonna make it on time. So we did.
She's in the office with you?
No.
Oh.
I was able to drop her. I might have done an illegal U-turn to get back to the office.
Well, listen, we don't want to hear, we don't want your boss to hear you say that, but we're glad that you're here because what we're talking about, and I've really butchered what this month is, but I believe it is, they say minority, but I say BIPOC men's mental health month, I believe. And so it not to add to anxiety, because I did text you at like 9:01. I was like, Doc, are we still good? But I figured you were either wrapping up a meeting or coming from something, but I thought it was important to have you here. But before we get into the business, you counsel, you advise the mayor and Dr. Ojakutu around behavioral health. There's a lot going on. I'm sure the trauma team taps into you, different departments. So I have to ask you, and as I said, you're a dad, you're a husband, you had to get your daughter to school. You got lectures and appearances and PubMed things to get done. How are you doing, Black man?
Oh, yeah, no, greatly appreciate even slowing down to ask how I'm doing. I am doing relatively well, given all the things that are happening in the world, city as we speak, and really do continue to be blessed. So I am a person of faith and fully recognize the vantage point that I have. It's one where when we're doing public sector work, we really are, I like to say, the safety blanket, not safety net, because the net has holes in it. And as a safety blanket, we really do hear about and really recognize when families are experiencing things that no family should. So we be that the loss of a loved one, untenable living situations, kind of daily barrages of, they say adverse experiences, but whether we're talking about like poverty, just financially, poverty from a hunger standpoint, environmental stuff, being able to bring the voices of people like to the table, like literally to the table, is both an honor and a privilege. So like even yesterday, I was talking with community members about the renamed Mel King School. And there's new leadership there, and trying to really shift the narrative of what the concept of like a therapeutic environment is for a school. And so, I'm doing well. And again, appreciate you taking the time to even ask that. I should ask the same of you. How are you doing?
I'm the host here, but I'm doing well. I could use a session with your you got me stuttering, so you messed me up there. I'm doing okay. I'm actually doing very well. Health wise.
Now you say that and entirely recognize that this is not a therapy session. However, let's do a little processing here. You're quivering while saying I'm doing well. So is that a genuine Jimmy's doing well, or Jimmy, the personality, is doing well,
You're not going to do me this morning.
but is Jimmy doing well? Is James doing well?
So we, this platform is authentic and organic. And so let's do this and exemplify what brothers need to do. I think we're conditioned, and from this sort of trauma informed space, that when we are actually authentically doing well, that quiver or that thing that you sense, I think sometimes is a conditioning to being used to not doing well. And when we're doing okay, I'll be honest, 2020 platform started. First time we had got like a major contract and I was doing okay and things were good. I called a friend of mine who's a therapist and I said to her, hey, I'm going through something. Everything is well, but I have anxiety because I think that something is going to sneak up on me and just pull the floor out from under me. And so to answer your question, I am, with the awareness of the work that it's taking to stay okay, journaling. Health wise, I've been juicing. I got more fruits and vegetables in the house than I do processed foods. I'm not eating as much processed foods. So I am doing well with the serious authenticity of despite, if you will, finances, wanting to get a house and all this other stuff. And so, yes, sir, I'm doing much okay. I could use a beach and a ocean in my life right now, but overall I'm doing well. And I appreciate you asking, because it's not often where folks, say it generally here, but this space in the past few minutes for me to answer that publicly, it's much appreciated.
Yeah. No, and we have beaches in Boston, just FYI.
You just, doctors, you're messing with me this morning, but that's this. It's bringing black joy.
No. I do appreciate. Getting out in nature is good. Whether that's going to the arboretum and just walking around the garden. My wife and I took the kids to Storyland in New Hampshire.
Okay.
This past weekend. So you do need time in what I call just natural spaces to recenter and feel grounded. And I appreciate you acknowledging the challenge of being in the present when things are going well, like actually going well. And because we do have we're always, or some should be aspiring to, like, oh, what's the next thing, right? Like, what's that next, whatever, the goal, the contract, the house, whatever it is, someone's pursuit in school, pursuit of career. And then there are times where, you're and I had this conversation with my wife, I think 2 years ago. And it was one of those where it's like, oh, wait, I think this is that thing that we've been looking for, where, oh, I enjoy whom I work with. I enjoy the people that I get to engage with. I appreciate the patients and families that I work. Like, I was actually like enjoying and continue to enjoy the spaces that I'm in. And even with my own therapist, I've had that, like, oh, how do I like maintain that ability to appreciate the space I'm literally in? Because it's very easy to kind of forecast, like, okay, well, what is going to be, what should I be pursuing? And yet it's like, no, this is that thing that you've been actually working towards. Be present. And that's just a challenge, not just for you or I, but I think for all of us, because it's always the idea, like, keeping up with the Joneses.
Yes.
And my friends in a group chat say, oh, we're all posting the different things that we're doing. And it is like motivating. And simultaneously, we have to remind ourselves, you have to find joy and happiness for yourself. It's not actually in a tangible thing, right? Because you get the show. And you might be like, so this is what it means to have a show. Okay. All right, what's next? And that's really what, and people will look and say, oh, well, how did he do this? And it's like, well, you've been pursuing this for a while. And then you get to that space, and it really is Kobeism or a theme in the idea of winning, right? It's your present, and winning is consistently chasing the win. You get it, and it's like, great, what have you done for me now? It's like, I got a show, right? But it's like, yeah, that's great, but what are you doing now? And so that's what we're all trying to manage, I think, in all of our respective spaces of work, influence with each other.
Dr. Simone, let me deviate a little bit, and thank you for the micro of sort of a status check of where Black men are. You and I did it on a micro level with sharing. I went a little more deep, but on a macro level, based on what you just said, our brothers are dealing with a lot. And I asked Chris Henson about this, a life coach that was on Monday. You talked about being present. You talked about the chase and the rigor that we have. Pay the bills, satisfy the partner, take care of the children, show up at work on time, mow the lawn, put the picture up.
Yeah.
Wide variety of leave on time to Storyland to get the kids ready and be back for your planning for the next week for a talk you got.
Yes.
Sir, what do you say to Black men, to men, to humanity that just feel like it's so much and we don't get the opportunity to be present with the good? What's one or two tools to help us be present and be like, you know what? I did that.
Yeah. So here, I think it's important to think about, and as I'm in this venue, can I share my screen at any point?
It's not set up like that.
Okay. That's
we do stuff in real time. If you send me whatever, I have the ability to. So if you email me, we can take a commercial. You can email me and you can bring it up.
So we might do that. So okay. The thing that I want to, in reference to answering that question about how is it that Black men can really be mindful about trying to manage all of the different domains that they exist in, right? So work, interpersonal relationships, self-motivation. It is important to try, and I say try, not do, but to try to establish some routines in the varying domains of our life, right? And so you reference juicing, not the Sammy Sosa, Mark McGuire kind of juicing, but the healthy, kind of juicing. That is equally as important to sleep. That is equally as important to engaging in a therapeutic platform, whether that is journaling, whether that is talking to a licensed mental health professional. If you have a spiritual life, engaging in that clergy, church, friendships, exercise, doing work that is meaningful to you, right? Like when we're off on one of those domains, it does shift how we feel in the other domains, right? And so I can tell for myself, if I don't play basketball, not that I have to play basketball every day, but if I don't play basketball for long stretches of time, because that's like my personal joy space, right? Mm-hmm. Like we all have this space where for kids, we call it play, and adults, we like to play too. I can recognize that I might feel a little bit more irritable, have a much lower tolerance for certain things. And my wife will know, I'll say, oh, I'm going to go hoop at DLA or New Mission or whatever on a Saturday morning. And she knows that, yes, please go.
I was getting ready to say, has she ever said to you, baby, you need to go a little bit?
Yeah. And because in that venue, in that space, and people that play with me will realize, like, I engage much differently in that space than I do here.
Yes, sir.
And we all have to have those forms of outlets, because it's very difficult to be the representation, and I say representation of who we are in community and outside all the time, where we have to have a true space where we can truly be our most natural, vulnerable self. And so for me, that is on that 90-foot court where, 2 weeks ago, I'm like, nah, that was a foul. and I'm getting as riled up as possible. And people like, nah, and I'm like, no, he fouled me. They're like, did you see it? It don't matter. I felt it. Someone fouled me. We're not going down there. It's my right. Like,
Get it out.
yes. And you have to have that kind of space. And unfortunately, when you don't, what ends up happening in a therapeutic way, we would say, like, there's a lot of projection that might happen, right? So here
Yeah.
it is. I'm not doing the yoga, or I'm not juicing or journaling. And there's a space where some stress, tension arises. And here it is, you've projected or you've acted out towards someone that doesn't even know, like, whoa, where's this energy coming from?
Mm-hmm.
And the truth of the matter is because you have not allowed that energy to come out in the correct space.
Yep.
And so then it comes out in the wrong space, right? And so that wrong space could be the nightcap drink, but not on the Friday at 5, but every night, because that's
At 10 o'clock to go to. Someone just said that yesterday,
right?
To go to sleep. Yep.
So these are the things that, if we're not cognizant of, and we're not really trying to, if we're just not paying attention enough to it, it can slowly creep in. So if I don't get great sleep, it is more likely that instead of the water, I'm going to get a cookie. Not to say that getting a cookie is a bad thing, right? But it's right place, right time. And because we're trying to juggle so many things, if you're not cognizant, you don't have a team around you, because it's impossible to do all this stuff by yourself. I tell people that all the time. You have to have a good, when I say support system, like friends that you're checking in with,
Yep.
People that genuinely care about you, and the you, not the representation of you, but really you. When we don't have those things, we're much more liable to engage with people, engage with ourselves in ways that are not as helpful. Yet you can also learn in what we'd say like a maladaptive way to engage inappropriately.
You talk about routines and coping mechanisms, and we, I believe, inadvertently form those routines and habits of coping without realizing it. As we talked about the nightcap every night at 10, or the blunt to go to sleep, or and I hear from you maybe a different type of intentionality to manage those spaces. I also heard from you, just to recap a little bit, develop healthy routines that include good sleep hygiene, outlets, hydrating. You referenced the water. And when one of those are off, we can potentially feel that and either demonstrate that to someone that has nothing to do with our mismanagement, or we compensate in other ways that may not be as healthy. Right. Before we get ready to take a break, I want to ask you about, and I asked, it's funny, this is coming up again this week. I asked the life coach that was on Monday about this. I also heard from you vulnerability. You talk about your circle, vulnerability being, as you said to me, James and not Java with Jimmy. So there's vulnerability, there's trust, because I have to trust these dudes. And then I also heard accountability, to kind of, when you're out of balance, dudes will be like, yo, the other day on the court, you were a little extra. What's going on, bro?
Right.
So on the other side of this commercial, I want to maybe delve into those three things: trust, vulnerability, and accountability. And then anything else, because Anissa has notes in here and I have yet to look at them. But this is an authentic, organic space. So
I know you gotta go commercial, and I really want to touch on those topics, particularly as they relate to our young men or
yes,
boys.
Yep. And we can get into modeling and everything, because the young men are watching what we're doing and they're modeling what they see. And so we're going to take a quick 30-second break, Doc, and we'll be right back.
For the innovators, the dreamers, the risk takers, independent workers who keep our neighborhoods thriving, Connector Care from the Massachusetts Health Connector has plans for every lifestyle and budget.
Having access to affordable healthcare is for everyone in our community.
Connector Care plans help more people save on healthcare that covers all their needs. Find out if you qualify for Connector Care. Visit mahealthconnector.org or call 1-877-MA-ENROLL.
Hey, folks, we are back. We're talking with Dr. Kevin Simone, who is the Chief of Behavioral Health for the City of Boston. In the first segment, he interviewed me a little bit, did a check-in on my mental health, his as well. And we talked about a lot of things that have to do with being present. And also toward the end of the first segment, we talked about the idea of how we cope with things though life is going on. And so what I asked Dr. Simone about and what he's going to talk about now, especially for our young men, is the thing of vulnerability, trust, and accountability. 3 things for brothers that can be interesting at times.
Right. So in reference to trust, vulnerability, accountability, particularly as it relates to young people, and clinically, I engage young people that sometimes are in our systems. So like Department of Youth Services, Department of Child and Family Services, so foster care, juvenile justice, or injustice. And, for a subset of them, they end up engage in with affiliations, right?
Yeah.
And, oftentimes when I'm talking with, for instance, our medical trainees, they'll ask questions like, oh, well, what's the crime that the young person did? And I often have to pause and kind of slow them down and say, oh, well, crime is a conception of who's doing the activity. And I said, and I do frame it that, the affiliations or the relationships that these young people have, from a psychological developmental perspective, are protective of them, i.e., I'll give you an example. Be a 12-year-old or 11-year-old grows up in one of our housing projects or housing developments, and the home is quote unquote fractured, right? And what does any young person want? They want someone who is attentive to them. They want somebody that positively praises them. They want somebody that makes them feel joy, right? And if you're a young person and for whatever reason your native home isn't providing those things, and then there's somebody who's like, hey, little bro, just look out for me, man. And you look out and they're like, oh, well, hey, man, you know what? You looked out like, oh, man, here's a ball. And now you're like, oh, man, this is awesome. I got a ball just for looking out. And then the looking out has built some trust, right?
Yep.
Positive praise. You got a ball. And that's at 8, right? 12 years old. Oh, yeah, man, here's $50 because you looked out and did some more activity, right? And that's building trust. And that's building I'm revering this person who's able to give me something that I can't get at home. And now maybe there's an ask, right? A true ask. And the ask seems skewed, I should do what? I should.
Where that ball turns to an 8 ball. Let's just keep
right.
it 100.
Yes, right. It's and because the right and wrong, good, bad is again, you're 8 years old, 10 years old. It's all being, the reality of that is being formed in real time. And so it's actually hard to know, is this good? Is this bad? So then you engage in something and you get a huge reward
Yep.
for engaging in the activity, right? And so you could be, and I've met young people, 13 years old, somehow has $1,000.
Yep.
That is so skewed in terms of like reward that it makes it very difficult to say, well, if you just go to school and you get good grades, I'm gonna, sign you up for camp. Camp? What are you talking about? YMCA, which is a great program. My daughter's in it. But if the counter, somebody gave me $1,000, that's a lot
just
of chips.
be on the block and look out. Yep.
That's a lot of chips. That is just a lot for a 13-year-old.
That's a lot for a 30-year-old. Let's keep it 100.
Yes. And so now when I meet that young person, the risk to reward ratio is so skewed that it's like, well, if I just do this and I haven't been caught so many times, I could do it one more time. Right. And it begins to, that can morph into when I meet that same young person and they've lost a friend, right, to firearm violence.
Yep.
And I ask them, like, I'm trying to get to them, right? Not who they're presenting themselves as, the mask on. And like, not, it is what it is. I'm like, no, it's not is what it is. You shouldn't be losing friends at 14 to firearm violence. But they've had to create this invulnerability, because if they are vulnerable, that can get them
killed.
Yes. And so when we're talking about this idea of how do you establish vulnerability, how do you establish trust, for some of the community that we're talking about, so early on, it is shifted in terms of what trust is, who you can actually be vulnerable with, that, by the time you are 25, let alone actually get to 35, it is so skewed that you really have to relearn the concept of being vulnerable, because in the past, vulnerability led to bad outcomes, right?
Yep. Gotcha.
So I'm just acknowledging that for some of our young people, they're in environments where I fully recognize sometimes when I'm thinking about things theoretically from what I learned, I have to really adjust. 'Cause I'm like, no, when you're in cell block, you have to think very differently.
Yep.
When you return to community, you got to think differently. And it's always interesting to meet a young person who might have been in and out of our system, and then meet an older person that has been in and out of adult systems. And sometimes there is this reflection of like, I want to help the young people not go down that path. A program that we have with our Boston Housing Authority called Credible Messengers. The Credible Messenger is very powerful, and we're doing this in Franklin Field area. Credible Messenger is powerful because there are people who have certain lived experiences that I don't have.
Yep. And
when I engage with that 12-year-old, they see me as, I'm Dr. Simon, Dr. Simone. Yeah. You're not from here. What you want me to do this BS camp? Like, I'm trying to get this money, right? Like, that's what the engagement is.
Yes, sir.
The Credible Messenger can be like, nah, homie, you don't want to go to Big Boy. It ain't what you think it is. And the Credible Messenger might actually be able to get a message across that can pivot that young person's perspective, where they develop trust because they see that person as, wait a minute, oh, you really know what hopping off the porch is. Like, you really understand that, right? So I'm just acknowledging there are ways that we're trying to reshape this idea of trust, vulnerability, accountability. You know, again, credible messenger, or someone, and I have young people, you know, call my office at varying times, knowing that I'm going to be here, and I'm like, you know, what's going on? And they're like, nah, man, my mom's is X, Y, Z. I'm like, and my mom like, well, your mom's placing appropriate, you know, precautions in
Restriction
place.
on you. Yeah, yeah, yeah.
Yes. But you know, hold on, let's not lose our cool yet. Because it can be very, very challenging to, again, try to actually in real time
To
shift.
shift.
It's very easy to say, but literally to do it, so much more challenging. And I've been in homes when somebody has wanted to go on the run, and I'm like, this is not going to turn out how you think it's going to turn out. And time and time again, it requires of, I'm going to say, us, the system, whether that's the city, whether that's clinicians, whether that's just people who engage with young people. It takes an incredible amount of patience to understand. You just have to sometimes create this, what we call holding space,
Yes.
allowing the
Be
person,
present. Yes, sir.
allowing the person to, you know, make some bumps, you know, trip a little bit, but allow them to recognize you're still not going to turn away from them. And so, unfortunately, a lot of young people have adults in their lives that have, for one reason or another, turned away from them. And I've heard it from some guys like, yo, Dr. Simon, nah, man, you come through. And it's because whether they're in the ED at Children's or Tufts or BMC, I'm likely going to try to make it there.
Yep.
And so just that idea of developing trust, and vulnerability, and you referenced the idea of modeling it. It's something that you really have to show them that you're vulnerable too. Otherwise, it just feels like a facade that you're telling them to do something that you're not yourself willing to.
What they would call faking they would say fronting or capping.
Right.
I want to be respectful of time as we're approaching, and I know you're busy, but with the credible voices, with the work you're doing, with the spaces we hold around, you know, the importance of mental wellness, Dee Dee's Cry and Pure Spark and Aisha Deed, why and what is the benefit of prioritizing this? It at one point, having a therapist became a sexy trend. You know, wellness is trending. And I want to center us that there's intentionality to why you're in the position you're in, why I have these conversations, why Naisha curates a whole plethora of different type of Black and brown providers. Why and what is the benefit to our community post-COVID, post-George Floyd, racism, poverty, social health, determinants of
Yeah.
why, sir?
So in terms of why is prioritizing your mental health, and I'll do a little distinction here, just mental health and then general wellness.
Yep.
Why is it beneficial? One, mental health and physical health are tied together. It is going to be very challenging to be mentally well if I'm not physically well. It's going to be hard to be physically well if I'm not mentally well. And there are times where you should engage in seeing somebody that is a licensed professional, and that's to say non-licensed clinicians and therapeutic practices, right? So the gym, the yoga, all of these things are what I would say are augmentations to doing well. just the same way in the physical health realm. If you tear your Achilles heel or tear your ACL, you have to go
And
to the surgeon. Now, either pre-injury or post-injury, you also have to go to physical therapy.
Yep.
Right? So there are grades of severity that require different forms of intervention. And in the mental health space, a mild, let's say, intervention might be that I journal. And I make sure that I go to the Arboretum, just as an example, because I'm at a state where these things, these practices help me to keep feeling good.
Yes.
There can be a point where, despite the fact that I'm engaging in the yoga, despite that I'm journaling, trying to juice and eat well, that I still am feeling truly down, maybe even having thoughts about it would be better if I'm not here.
Yep.
In that regard, you kind of want to make sure you tap into, maybe
Yes.
I need an emergency evaluation and a clinical professional to say, okay, you should continue to do these augmentative strategies, but there are other interventions that are, higher level or more intense that can be also beneficial. And I love when Naisha talks about her own experience of, at some point in time, there was true critical need for high level intervention.
Yep.
Got that high level intervention to get stabilized, and then realize, oh, there's these other things that I can do that maybe prevent me from getting back to that point. And so when we think about mental health and clinical perspective, and then the wellness arena, I ask people all the time to ensure that they're engaging in a variety of activities. And I say, you choose the one that you find beneficial. There was a recent announcement from Mass General Brigham in reference to something called the social prescription, which is a theme, and there's an organization where Mass General Brigham and this organization, the providers, I see you as a patient, and I might say, you should be going to like one of our many gardens that we have in the state, and get an actual prescription
To yeah.
go.
Yep.
Because they would cover the cost of, let's say, 5 visits, as an example. So we are shifting, like in healthcare, I would say we are shifting to recognizing most of the actual true care does not happen inside the building.
Yeah.
That is the hospital, the clinic. It happens outside. So what are you eating? How are you sleeping? What's the environment that you're in? So back to your question of why is it so important that we're emphasizing this. For a very long time, there are many communities that have not been really cognizant about how important mental health is. If we talk about our Afro-Caribbean community, and now I'm really pivoting to Caribbean community, there are certain, so I tell you, my parents are Haitian. I'm not sure I literally ever heard the word depression or heard the word anxiety other than my household until I myself was in school learning about it, because that's just not the language that would be used, right? So this is where it's important from a provider standpoint to be very culturally competent, culturally humble, to say, wait a minute, okay, when you are feeling, I don't know, fatigued, describe that to me, right? Because the Haitian mom is not going to say I'm depressed, but they might say, oh, I'm fatigué. I am fatigued. I am tired. And it's like, well, how long have you been tired? My whole life. And they legitimately may be very accurate. Like, it feels like my whole life I have been drained. And that mother that used to be able to cook the rice and peas and plantain.
Yes, sir.
All of a sudden, she's not doing that. And she seems to just be resting. Maybe she is truly despondent and has no energy. And so if she has no energy, she's feeling fatigued. She's not doing the activities she used to enjoy, because most Haitian mothers enjoy the process of feeding their family, right? And TM, you can kill me, let me go, right? Oh, that's suicidal, right?
Yes, sir.
That might be the indication of, oh, wait a minute, this is actually depression that we're talking about here. And so I'm bringing in multiple vantage points because it's important that as a community we have these conversations. And now, and I would say since 2020, we are having more of these conversations, and the role that I'm in is in part to ensure that even when we're thinking about economic policy, when we're thinking about environmental policy, when we're thinking about
education policy,
education, mental health is also a part of that, and that looks a variety of ways. So I just earlier talked about this idea about the Mel King. In this meeting, there were people that were talking about poetry. There were people talking about having the garden refurbished. They were talking about activities that the students and parents can engage in. And yes, we talked about the social workers and the clinical work, right? But we really want to say, well, being therapeutic encompasses many different interventions and platforms. So it's critically important to ensure that we are talking about this and normalize it, so that way when people need help, assistance, they know where to go, when to go, and what intervention is appropriate for the right severity in the event that someone's truly not feeling well. So I'd say that's why all this is important.
There's so much. And the only thing I could think of while you were talking a couple of times was, this is like an onion. When you begin to peel back the layers of first cultural family history, from things like what goes on in the house stays in the house, that has traumatized and hurt many of us, to you get through that first to fifth layer, then getting to a point of wanting to go to therapy or understanding or doing some of the work. And then sometimes another layer, there are systemic things, insurance, the rude person at check-in, the uncultured provider that, you say one thing and they got you on a section 12.
Yep.
And and sometimes that's valid, but just if I just imagine a Haitian mom coming in, speaking that, and the phrase that you used about "let me go, I'm okay," that's interpreted by the wrong interpreter. Let's talk about the layers and systems. Next thing you know, this woman is hospitalized for 3 days, to where it could have been talking through, she just lost her mother. So anyway, my point is that this is so layered, sir. And the reason why I asked the question about why you're there, why I have these conversations, I can't think of anything. It's not for naught. It's not just because it's this is important to us.
And let me say, in reference to the concept of the Section 12, and for the audience members that aren't familiar, Section 12A is involuntary transport to a hospital to get and receive a psychiatric evaluation. And I'm because you referenced it, I'm going to
please do.
Here.
Please, yes.
Part of the role that I'm in, I do collaborate with our Boston Police Department. And in reference to sections, right, there are 5 professions that can fill out a section. And the BPD research department and our department have looked at the data, and there's like a paper coming out, the academic hat.
Here. I told you the PubMed.
And in terms of the 5 professions that can fill out the section, right? I.e., I'm seeing something, and I think you need to get to the hospital, because the place that I'm seeing you is not the hospital.
Yep.
That's a licensed clinical social worker, a licensed psychologist, a licensed registered nurse, even including nurse practitioner, a physician, and a police officer. Those are the 5 professions that can sign the section. Now, what you did not hear was EMT or EMS personnel.
Yep.
Often, though, we call 911, and my colleagues from EMS will come. If you don't want to get on that gurney, there's only one profession that has legal authority to help you get on the gurney involuntarily.
Is the police.
Is the police. Now, what's interesting here is many people don't realize the four that aren't the police officers are the ones who likely engage you clinically. And they are the ones who are writing it. But I'm not going to write a section as the psychiatrist, I'm seeing my outpatient, and put you in my car to take you to the hospital. Now, this is critically important, and we don't have time to
No, go ahead.
There'll be a part 2.
Okay.
But it's important that we're cognizant of who's more likely writing the section, because who gets framed as the negative engager
from a criminal, as you defined, is it very different? Come on,
yes.
Sir, come.
The person that's going to be deemed as like the negative detractor, the negative person in this whole interaction is either the client or the patient. And then from a community standpoint, oftentimes is the police officer.
That's right.
Yet the police officer literally is mandated to engage in this way because I, the doctor, I, the clinician, I, the nurse, said, hey, you have to do this. And so there's a layer here of trying to break things down to understand, wait a minute, how did we get to this point that it's only the police officer that is allowed to engage in this
without
kind
clinical intervention or training?
Right. And so BPD does have CIT, crisis intervention training, 40 hours. But you can see that there's challenges. And this is why, again, it's important that we all communicate and we're not just in our silos. And so just because you brought up
yes, sir.
You brought up the word, the phrase section 12, I just want to highlight, we really are trying to think about all the layers and all of the facets that go into quote unquote behavioral health, mental health, including, yes, the section. And you know, this won't end up on the globe, but it's just as important as the investments that we make in schools. It's just as important as anything else. And so I'm just I appreciate that you brought it up.
Yes, sir.
And just highlight that we are actively trying to improve all of the system, but it takes a very long time because these things are complex.
It took a long time, strategically designed to get us here.
Right.
And it leads me to say, as we wrap up, Dr. Simone, that, you know, from clinical trials to mental health to other, you know, specialties that haven't always endeared us well in research and things like that, you're an example. And that's why I think it's so important on these health topics that we bring in Black and brown, typically marginalized folks, for folks to, we talked about trust and vulnerability. You have a you in these systems. So I need folks to understand that there are more of you in mental health. There are more of Dr. Kizzy from the Chan School that was very instrumental in the vaccination. And so that I can't let that go by, because just how, when I mention section, because I've been in the environment, I always fuss at people about our acronyms and language. I just did it. So thank you for breaking that down. And it also may help somebody understand that this weekend, next week, somebody that has not either taken their meds or just having a real breakdown, the police come and that person, they hear the term section. Guess what? They now know, rather than being, oh, the police are locking them up in a psych ward. No, they need to go be evaluated. And with folks like you in place, it's not perfect, but at least there are conversations and intentionality to ensure that a BPD doesn't section someone just based on perceived criminal behavior due to not taking meds or just life be lifing. So
right.
You said we're going to have to do a part 2 of this, and I would really love to, and maybe chat with you and Aisha in sort of an after dark in-person format, because it's very different. Talk about a little bit of the harms 33% of the time, and then the other 66%, let's highlight people and highlight tools and highlight the progress that is happening around us being mentally well and intentionally, impactfully, culturally addressing when we are mentally ill.
Right. No, so I would say, as it feels like we're wrapping up, I was just at a conference called NACHO. It's like national. It's basically a public health commissions of the varying
Of all the municipalities. Yeah.
their annual meeting, and someone was asking from a different state, how are you all in Boston able to seem innovative in this particular space? And I had to acknowledge that doing what we're trying to do requires so many different elements of our Boston Public Health Commission, from community, and there's no one entity, one person that supersedes another. And because of your platform, I'm going to highlight here, it is incredibly important to have. So, your producer was engaging with our communications director. If we're doing all these things and we don't have a platform to talk about what it is that we're doing, we might as well not be doing anything. If I can tell someone about 988 and 311 and 833-773-2445 and the certain circumstances in which to call the varying numbers, but I only put it out in English, but I don't put it out in Haitian Creole, Cape Verdean Creole, Spanish, Chinese, Russian.
Don't put up a billboard. Yes, come.
Right. So I was emphasizing to the other public health communities, you really have to bring everyone to the table, because if we don't have a good comms team, it makes no difference that we're doing these activities, because no one from the community will know about it. And so I'm just highlighting the fact that you have these kind of conversations. You don't know who's listening.
Yes, sir.
That will find benefit from it. But we know if we're not talking about it and we're not trying to blast this as far and wide as possible, harm will happen because the information did not get to people. So I just want to appreciate that you have this platform and you're consistent and persistent with it, because it really is important. And I just want to just highlight, communication is critical to any of these city efforts that we're doing. This is why we have a press conference. Somehow try to get this information.
Sir, you get ready to get me in a whole different place. Because go ahead. Yeah.
No, so I just want to just acknowledge your platform, our comms team, Jessica Pierre and the mayor's comms. I wasn't even as keenly aware of how important this is, in part because the vantage point that I was coming from was very much clinically oriented. And yes, sometimes I'm thinking about the true public health realm, but it's like, oh, wait a minute, how do we message this and get it out? And I'm not a radio guy, but I got to know how to be on the radio.
Yep.
So I'm just acknowledging that. Really appreciate the fact that you take time to talk with myself, other providers, other people, educators, because literally this is sometimes a lifeline to getting people the information that they need.
I appreciate you, sir. You started out messing with me, and I already got a text. Somebody said, "Aha, you're turning red." It's appreciated, and I just want to, appreciate you, because affirmations, and this has a mental health impact, because we talked about the platform, and James, sometimes the struggle is real. And every once in a while, getting a text, hearing what you said, getting an inbox that folks are being impacted, it is just helpful. And so my 3 C's have always been communication. I see Michelle has 2 of them there: communication, coordination, and collaboration. Right. If we employ those 3 things across the board, we're good. And so we're a little bit past time, Dr. Simone, but I really I appreciate you, man, and you be encouraged for all that you're doing, because you're a Black man working in centuries old systems that have been led by, white women, and in good, most part intention, but without that life experience that you're bringing to the table to balance out the academic knowledge. And we never downplay your academic, because we need it. We need it. We need you to inform Ted Stern and Greg Fishone and all of them. And so, sir, thank you. Before you get me in a whole different place, is there anything coming up that we need to make folks aware of, either fair or initiative the commission is doing in this space, so we, as you said, we make sure folks know?
Yeah, no. So I would say, it's the summertime. We often have healthy events, opportunities for people to engage in outdoor activities when it's not a scorcher outside. Obviously, people know about the open streets activity, yes, because, again, that is therapeutic. Be outside, see individuals from your community, just enjoying. So the city is often doing activities, and from the public health standpoint, we're proud of the work that we're doing with BPS, with BPD, and trying to inform people about ways to just continue to stay healthy. So appreciate being here. Again, look forward to the next episode to be on, and just thank you.
Thank you. And again, be encouraged. And as Michelle D. Smith says, keep up the intentionality and advocacy in all that you do and strive and do. So, brother, we appreciate you, man. And you said you're a man of faith. We got the whole mother's board in here to be praying. So we pray your strength and encouragement, sir. And we'll chat soon.
All right. Have a good one,
brother. Listen, folks, I hope, like others, and as Dr. Simone said, that this episode was very helpful to you. Share it with a brother, tag a brother, and be intentional about the information. I just got a text about Jimmy, your eyes are turning red. It's just very helpful to hear about the impact every now and then, because sometimes this holding this down gets very interesting. So, anywho, I'm just being real with you all. We're going to wrap up. UCB, y'all are got me stuttering. Y'all are making out well this week. 90 minutes for today. It's 10:06, so we're well past time. Just wanted to remind you that we're going to wrap up this great week, and I hope you feel this about every week. Tomorrow, we're going to wrap up this great week of guests and information. Definitely had a equity and health and mental health focus, and we had Brother Neil yesterday. But tomorrow morning, we're going to wrap up with Lynn Perry Wooten, who is the new and first Black woman president of Simmons University. She's going to come in and talk about a lot of work they're doing, her vision, and what's going over there at Simmons University. So we are glad to have her here tomorrow. I believe that is it as far as announcements. One announcement, we are doing another episode. Probably will be a recording of Black Java, No Sugar, No Cream. And that's taking place on Thursday, August 16th. So 2 weeks from tomorrow, Thursday, August 16th. Thursday, August 15th. Thursday, August 15th, we will have another recording of Black Java, and we're looking at talking about Black Boston, or just, Black Boston. We're going to talk about some music. We're going to talk about politics, and we're going to talk about probably where economics are. And so we're in the process, in the background, doing some of those things now. He pops in every now and then and is very quiet and behind. And if he sees this episode, I want you to see this. We have a young intern with us this summer by the name of Gary McQuarrie, and his impact is soon come on here. And he's going to be very involved with the development of that episode. And we appreciate everything that you're doing, Gary. And we look forward to some great things in these next few weeks and even after. So Gary, just shouting you out and saying hello. You all may see him. He's very under the radar, low key, but very knowledgeable and opinionated and younger. So he's definitely having an impact with us in this space and reaching a different audience. All right, folks, that's it for me. Sharon Cornelius. Good to see you, Michelle. Excuse me. Michelle as well, and others that are in the room. Sister Soraya, Gail Crump Swaby, Jewel over on YouTube. Shout out to everybody that's listening on Twitter. Hit and jump in that live chat and let me know that you're here. Let me go and see if anybody's in there, because I'm telling folks to go in and I'm not even on there. So let's go see if anybody is in the live chat. I got the volume down. You press here, supposedly to join. I don't know how you oh crap. Okay, there's the live chat. I'm just going to see if it works real quick. Let's see if something pops up here on StreamYard. Oh, Twitter people, y'all can comment and stuff. So yes, mother will eat and drink. And thank you for saying welcome to Gary. All right, I'm getting off of here, folks. An hour and a half for UCB. Shout out to everybody on Instagram and Twitter as well. Good to see all of you all in. There's 57 of y'all watching on Twitter. Wow. All right. Might need to do some Twitter spaces just over on there, just for you all. Thank you for being in the room. Shout out to Real for sharing and others. We'll see you guys tomorrow at 9 a.m. Have a great day, everybody, and we will talk to you soon.